Welcome to the Safety and Risk Success podcast with me, Christian Harris. Every September, we shine a spotlight on slips, trips, and falls through my Sliptember campaign, raising awareness of how these incidents can be prevented with science and simple, practical steps. In today's episode, I'm delighted to be joined by Jules Robinson, Posh and Falls Manager at RoSPA, the Royal Society for the Prevention of Accidents. Jules leads RoSPA's Fall Fighter campaign, a fantastic initiative designed to help organisations, communities, and individuals reduce the devastating impact of falls. We'll be exploring why falls remain the leading cause of accidental injury, the misconceptions that hold us back from addressing them properly, and the innovative approaches being used to protect people both in the workplace and at home. As always, you'll hear a blend of insight, data, and practical actions you can take away and apply straight away. So let's get into it. Here's my conversation with Jules Robinson.
Welcome to the Safety and Risk Success podcast with Christian Harris. We believe that proactive safety and risk management powers business performance. Each week, we explore this theme, sharing guests, stories, insights, trends, hints, and tips. You can find us on all the major podcasting platforms, and video versions are available on YouTube. But for now, let's join the conversation with Christian.
Thank you, everybody, for joining this Safety Roundtable session today. It's the first of the Sliptember 2025 Safety Roundtables, so we're having a bit more focus on slips, trips and falls this month than we would normally. Sliptember, if you've not heard, it's a campaign that I run every September to raise awareness about slip accident prevention and what you can do in a scientific way. Everybody who joins today as a present is just going to get a copy of my book. So I will email you out and get your address, or you can email me your address and we'll send you a copy of the book. We're giving lots and lots of books away this month for Sliptember. So today I'm really pleased to be joined by Jules Robinson from RoSPA, and I'll get Jules to explain a bit about her background as we get into it. But we're going to be talking about the Fall Fighter campaign, which is something that RoSPA has been running for a few years. As always on these sessions, it's interactive, so very much welcome your questions. Jules and I are happy to chit chat and go through things for the whole session, but it'd be much better if we can get some interactivity from those of you in the audience. So if you do have any questions or any comments, or if you want to share your experiences about this, then just go to reactions and raise your hand, and we'll call you up and we can talk all about falls. So with that, I will stop sharing my screen and I'll say, Jules, thank you for joining today. Let's start with a bit about your background. So you were telling me the other day you had some experience of workplace injury. So how did that affect you and kind of lead you down the path of working in health and safety? Because obviously that's not what you were doing at the time.
Sure. Yeah. Thanks for having me, Christian. Really pleased to speak to you guys on September. My first career really was in marine conservation. So that took me around the world, working with animals in various tropical locations, none of which really are guided by the strong safety principles we have here in the UK. So, of course, that led to injury. I put my back out lifting some heavy stuff around the beach in Maldives, which sounds awful, but I did get to travel back business class. Clearly, that highlights the need for a better management of the tasks that staff are undertaking and the kind of processes we've got in place. So it was very formative, I think, to have first-hand experience of workplace injury and what can happen when things go wrong.
Yeah, definitely. Yeah, I mean, I think my story and my background, but I suffered not a workplace injury, but obviously an injury. And I think when you do suffer from something like that, or somebody close to you suffers, then that does give you a new appreciation for safety. And we'll get onto this in a minute. But obviously, one of the points around falls is that we all know, without exception, we all know somebody who's a bit older and a bit more susceptible to this. So that's why this a very, very pertinent topic for us to be speaking about. So talk to us a bit, Jules, about what got you actually interested in this particular sort of niche of safety of fall prevention.
Yeah, it's quite a big niche, isn't it? I think when we
Well, yeah,
think think of falls, it's kind of everything lumped into one. Of course, there's falls from height, falls on the level. My health and safety experience started in a logistics setting. So heavy freight, forklift trucks, HGVs through the warehouse. And of course, that comes with slips, trips, and falls risks aplenty, not least affecting kind of office workers who sometimes find themselves in the warehouse setting for a variety of reasons.
yeah,
So again, it exposed me to the different perspectives that people have on slips, trips, and falls risks, and the different approaches that can be taken, effective and not effective, to managing those risks. So it was a very good eye opener, I think, to the impact of what processes are effective and what culture can be useful and what can be quite hurtful in terms of culture and process.
yeah, yeah. Okay, and we'll talk more about that in a second. Just for a bit more context, though, if people haven't heard of RoSPA, perhaps you could give a quick intro as to what RoSPA is and what RoSPA does.
Yes, so my involvement with RoSPA started when I moved from my logistics job into social housing. I worked for a company called Trent and Dove, and they were the winner of the Sir George Earl Trophy, which is RoSPA's highest accolade. So RoSPA run a big awards ceremony every year, and the tip top gets this Sir George Earl Trophy. So I was really lucky. I got to go and work for that organisation, Trent and Dove, with their very strong safety culture and exemplar management processes. My role there was customer health and safety advisor. As part of that role, we developed a year-long fall prevention project where we wanted to take the principles of slips, trips, and falls management from the workplace really behind the front door of vulnerable customers who were kind of 60 plus and living in our homes. Um, Applying those principles was a bit of a challenge because they're designed to work in workplace settings and not so
Yeah,
much in domestic settings. But that's where the synergy with Fall Fighter kind of comes in, and where the interest from RoSPA really started. The work that we were doing at Trent and Dove ran kind of alongside Fall Fighter and complemented that work. And in using Fall Fighter and providing kind of home checks for these vulnerable adults, we were able to reduce the incidence of falls for them by over 69% on average. So that certainly attracted a bit of attention. And then the project itself was awarded the first fall prevention trophy. And that was sponsored by Barclay Group. So that was a great honour, and I think a good kind of highlighter on what can be achieved in a short space of time when you use the right principles in a good space with a good culture.
yeah. So well, fantastic work and very well done for that. And then I don't actually know the backstory here. I don't know if you were then sort of headhunted or how it worked, but
My
you
contract
sort
came
of
to an end. Yeah. RoSPA didn't poach me. My contract came to an end at Trent and Dove. So that was a great stepping stone. And then obviously moving to work at RoSPA as the Falls Engagement Lead. My remit has just been extended a bit further into kind of OSH and Falls Manager. So I'm really pleased to be making a foothold in RoSPA. RoSPA is a very old safety charity. And we have a foot in lots of different camps across UK society and across the international safety networks as well. So we look at kind of road safety, leisure safety, home safety, product safety, OSH, you name it. RoSPA's got something to say on any kind of safety matter.
Yeah, and for those of you who are interested in podcasts, I actually interviewed the RoSPA CEO, Becky Hickman, a few months ago as well, and had a really interesting conversation about some of the stuff that RoSPA does and how Becky and RoSPA see the world. So I'd recommend checking that one out as well. So let's talk a bit more about falls then. I mean, you kind of alluded to this before that it's quite a big niche, but many people don't realize how serious and how costly falls are. What would you say are the biggest misconceptions about falls prevention?
The biggest one I think we're up against is that it's just a part of being on two legs, that falls happen to everybody. Particularly, I think as we age up, certainly into retirement, people associate falls with getting old,
Yeah,
and this sense that they're just inevitable and it's just part of being. That's the biggest challenge. And of course, you see that in accident prevention across the board, where people just, oh, it's an accident, these things just happen. And as safety professionals, I think we're up against that in a broader sense. But certainly with slips, trips, and falls, they can be trivial or they can be really serious. People tend to think of the very trivial ones until they think of older people. So
yeah,
in a workplace setting, I think we do get pushed to the side, and you think, oh, like I'd much rather prevent this manual handling injury or this scald or this, this very severe seeming injury than just a slip or a trip.
yeah, yeah. Definitely agree with that one. It's there's a big mindset challenge that we need to overcome. So is that the main reason why falls maybe get less attention than other safety topics, even though they are, as you and I both know, one of the leading causes of injury?
Yeah, perennially the leading cause of kind of the non-fatal redors, over a third, slips, trips, and falls on the level. And you kind of think, if a slip and a trip is so trivial, then why is it making it across to ridor? And you think, actually, even falling on the level, even as a fit and well adult, can cause real injury. You break your wrist at work. There's a lot of things that functionally you just can't do independently anymore, and that clearly has a knock-on effect on friends and family and life outside of work.
Mm.
Fatal injuries as well. I mean, we know that a lot of fatal injuries occur from falls from height. So the stats, they tell us that fatal falls from height are the leading cause of death from work. So whilst there's certainly a tendency to trivialize the slips and trips, the data tells us that these are not trivial injuries. They can be very harmful. They can be very long-lived in terms of the consequences, and they're certainly more deserving of our attention than I think sometimes people give them credit.
Yeah, no, absolutely. And there's also, in the home environment, falls downstairs is a massive problem and cause of very serious injuries and deaths as well. And particularly in the UK, where we have these in these kind of Victorian properties, which obviously are very common. The stairs are very steep. Um, the, uh, the flat section of the step is often pretty narrow. So we're kind of designing in risk, which is obviously not an ideal thing to have, to say the least. What about, you mentioned it a bit there, Jules? What about the kind of impact on, there's obviously the person who suffers the fall, but what about the impact more widely in terms of their families, organizations that they might work for, NHS, and so on and so forth? What do you see in that sort of area?
Yeah, I mean, clearly any type of injury is traumatic. And I think sometimes we focus on the physical outcome that we can see, like I just mentioned, the fractured wrist. Maybe if you're an older woman, you're more susceptible to hip fractures due to osteoporosis post-menopause. If you are hurt physically, that has an impact on your ability to take care of yourself and other people around you, your children and dependents. But the psychological trauma of being injured at work, I can speak firsthand. It rattles you. It
Mm.
means that you might consider, oh, is this the right role for me? And at a time when we're all struggling with recruitment and retention, it's so important that we're enabling our staff to feel confident at work, to feel safe and protected, physically and psychologically. I think with slips, trips, and falls, we're not very good at, as we said, taking them very seriously. Reporting of a near miss slip trip, very difficult to get hold of. For example, if somebody picks up a piece of rubbish from the warehouse floor, don't necessarily think to report that as a near miss. But if everyone is reporting that, that might highlight a problem in process, and then you might actually make a change that saves an accident down the line. So I think
Yeah,
there's an argument for a shift in the way that we see near miss reporting for slips and trips, as well as as I say, the kind of the psychological impact can be very severe on
yeah.
people. and particularly if it affects their, as I say, their life outside of work, where they're suddenly unable to take care of themselves. I think that can have a real psychological impact on workers.
Yeah, yeah. I mean, one of the most tragic cases that I was involved in was a slip in a supermarket. It's all in the public domain. It was a co-op supermarket in Cornwall, and um, the this gentleman Stanley May slipped on a puddle of water from a leaking chiller. He banged the back of his head, and then he passed away a couple of days later. But then shortly after that, and I think this is quite a common phenomenon among people who've been married for many years, and then one of them passes away. His wife, who was in seemingly quite good health, sort of passed away quite soon after that as well, which you can only, put down to sort of the shock or the grief or whatever, I guess. So yeah, it does. There's massive knock-on effects from these things that we don't always take into account, sadly. What about some data, Jules? Have you got any sort of headline data in terms of how many people are falling and how many older people are falling, for example, and how many people are going to hospital, that kind of thing?
Yeah, so November last year, RoSPA actually launched a massive data analysis from accidents caused across the UK. We're calling for a national accident prevention strategy. So as part of that, we asked ourselves the question, well, how many accidents actually happen? It's difficult to bring together all the data from across the UK because it's recorded in various different ways across the 4 nations, but we managed. It's a big piece of work we managed. It'll be no surprise that falls are amongst the greatest cause of accidental injury across the board. As you mentioned, older people suffer more falls and the worst consequences, so they're often at the sharp end of fall-related fatalities and injury. When we look at the trends across the past decade or so, we looked at data from 2013 versus 2023. That was the most current data available then. The number of deaths resulting from falls had increased by 90%, 90.
Wow.
So almost doubled across a decade. And you might think, well, okay, we know that older people are both more affected by falls and suffer worse consequences. We know we have an aging population, but not 90% aging population. This is not just a correlation with the aging population. This is a serious decline in the control of fall-related risk. Now, we didn't do any causation analysis into kind of what is behind this, but when you look at the literature, you look at the kind of the clinical research into why older people tend to fall, it's comorbidities. So having existing medical conditions that affect their strength and balance, but it's also sedentary lifestyles, which I think we can all relate to. Probably all of us sat down at the moment. So the more we sit, the weaker we get. That means when we get up, we're less able to keep our balance and recover from any slips and trips that we do encounter. We're more likely to have a fall as a result, and then an injury as a result of that. So there are lots of things at play, but certainly that 90% increase across a decade is a shocking stat. I was blown away by that level of increase. Across society, across UK society, that's 400,000 people going to A&E every year as a result of a fall. And clearly that imposes an enormous bill on kind of health and social care systems as well. It's horrible to put a pound sign against it, but it's about 4.4 billion, or at least it was 10 years ago. So you can imagine the kind of the cost to society is enormous. And of course, we know that these kind of comorbidities and sedentary behaviours are appearing in people who are younger. So sometimes we tend to look at over 65s as kind of like, okay, well, that's retirement, it was retirement age. Let's start there and let's look at the number of falls people tend to experience. It's about 1 in 3. So over 65s will experience one in 3 chance of falling every year. By the time you hit 80, it's about 50%. So 50% of 80-year-olds will fall every year. So you start to get an idea of how big a part of life it becomes. But certainly, as I say, I think these comorbidities, this sedentary behaviour, and these risk factors are creeping down into our working age population, where we might have people exhibiting kind of frailty characteristics that we'd associate with someone in their 70s. They may start to exhibit them in their 50s, 60s, when they're still part of our working age group.
Yeah. A few things to pick up on there. Starting with the data around the likelihood of an older person falling. I saw something. I can't remember where it was from now, but it said it gave very similar data on the likelihood per age of someone falling, but this was specific to people in care, and I'm pretty sure the data was if they suffered one fall, then it was something like 65 to 70% that they would suffer another fall within the next 12 months. So that kind of explains why this preventative approach is really important, because the first fall almost seems to inevitably lead to another. So I think the more we can do around preventing, certainly among that age group, clearly the better. And then the cost thing, I mean, I was glad that you gave quite a high number there of, I think you said 4.4 billion. One of the frustrations I often have is there seemed to be some data, I think from HSE, probably 10 years ago now, saying that the cost of slips, trips and falls was 500 million, and people seem to have got this in their head as if that's accurate. Not that that's an insignificant amount of money, but I mean, we did some analysis, actually not even really analysis. I mean, on the AXA insurance website, there's an article there, and it says that in 2018, AXA spent 80 million, 80, of claim costs on slips for getting trips and falls from height, just on slips on the same level. And that compared to 30 million for manual handling as a comparison. But if you think AXA, although they're well known, they're nowhere near the market dominant force of insurance. So if they have, let's say, 5% of the insurance market in the UK, that means there's 1.5 billion of slip insurance claims if you extrapolate the numbers per year in 2018. And what's happened since 2018? Well, we've had massive inflation, haven't we? So, if anything, the cost of just slips on the same level is massive and rising, never mind all of these other things. So I do think, that cost piece is really important, both the human cost and the financial cost, because that's, I guess, how we can encourage organizations to do more, is talking about the financial cost as well as the human cost.
Yeah, and you mentioned the pandemic there, kind of the 2018, what's happened since 2018, a pandemic, during which a lot of older people or vulnerable people bubbled. So they stayed indoors, they didn't exercise, didn't go out for some time to protect themselves from COVID. In doing so, became quite physically deconditioned. So we know that, sitting on an airplane for 8 hours, can affect the way we walk, can affect our muscle strength, our leg strength, and our responsiveness. Clearly, if they were bubbling for some weeks or months, the extent of physical deconditioning is quite severe, meaning that now we are seeing an enormous spike in fall-related harm, both kind of injury and death in our older age population as a result of that. Yeah,
definitely, yeah. So let's move on to talking about what we can do about it then a little bit. So give us the background as to how the Fall Fighter campaign was kind of conceived and how it came to life at RoSPA.
Yeah, so this predates me. I'm speaking from the archives here, but there was a project to create the Fall Fighter training package, which RoSPA joined with RSA, the insurance group, to produce this material. We wanted to make sure that it was tailored towards people who were most at risk of falls, which we know we've talked at length about it being slightly older people. But what people underestimate sometimes, especially if we OSH professionals, is that over half of hospitalizing falls happen at home. So the decision was to focus on older people and to focus on the domestic environment as a place where we could make the greatest impact in terms of preventing accident-related harm. So this is a piece of training material that takes the kind of the philosophy of kind of slips, trips and falls management and applies it to domestic settings. It also looks at the person's kind of health and lifestyle, which I think is something we could learn from. As OSH professionals, we focus on the environment and these controls. Reluctant sometimes to talk about behaviors or, lifestyle choices or, health, especially, to say actually, what can we do to reduce your risk as an individual, aside from, creating a nice smooth surface, clean and dry, So Fall Fighter aims to tackle falls at home from those couple of angles. So from the home environment perspective, provision of handrails, making sure that our rugs and mats are secured. We haven't got too much clutter lying around. We've got good lighting, no trailing cables. But then the health and lifestyle factors such as kind of eyesight, hearing, what medication are we taking? Are we very well hydrated? Are we rushing around, or is there any need for us to rush around that might increase our risk? And then looking at kind of how we're feeding ourselves and the kind of medication review as well.
Yeah. And it's really important, isn't it, to take that kind of holistic view. And but equally, it must be holistic, because I think certainly in the not so much. I don't think in my experience with the more elderly population, but in the sort of workplace setting, someone goes into a supermarket or a retail store or an office and they slip over or they trip over and fall and hurt themselves. There seems to me to be a rush to sort of blame that person rather than taking a step back and thinking, right, well, what's the environment giving us here? What have we done to set this person up for success, not failure? Let's not just blame that person, but let's look at the whole thing together. So it's good to see that is being done. So if somebody wants to kind of be a full fighter, then what does that actually involve in terms of utilizing that toolkit and going out and starting to make a difference?
So it's a free material that people can go onto RoSPA's website and download. It's a PowerPoint presentation. So I've written some notes in the bottom so that people are able to deliver it to groups if they'd like to. It's just fun to just read it through yourself. The idea is that it's engaging and you're given real examples of things you can change, both in maybe your own home or the home of someone that you know and love. The idea is to nudge people to make safer choices. As I say, to pitch practical, cheap, simple initiatives that really work. These are all initiatives that I used when I was out and about in my role in social housing. They really do work. But as with any safety advice, it has to be palatable to the individual. So I think you really stand yourself in good stead if you know the person that you're trying to protect in the first instance. If we know who our customers are, who our clients are, and what the risks that they bring with them are. For example, are we someone who always walks around in high-heeled shoes or in bare feet or in flip-flops, these kind of more risky things to do? If we know what's happening, we have to take account of those risks that people bring with them, and try to engineer an environment where those risks are offset. And if we can't do that, then we start to look at, okay, do we need to change these habits slightly? Is there a way we can reduce the risks that people carry around with them?
Yeah. So, and we'll give the links in when we put this out as a replay. We'll put all the links to the toolkit and everything there. But I'm assuming if people just go to the RoSPA website, they can, or if they Google Full Fighter, they can probably find the links as well, right?
That's right. Yes, that's right. We've got a fall prevention hub on the RoSPA website, and that's where all of our fall prevention materials are housed, and you can download them for free. There's also lots of videos. So there's OSH-related videos as well as kind of those aimed at older adults at home. I also did a bit of work recently with Tesco, and it's funny that you were talking earlier about the kind of the supermarket incident. My message to the Tesco maintenance crews was to think more so about older, frailer customers when you're doing your walkarounds and your risk assessments. It's so tempting for us just to do our risk assessments based on a 30-something-year-old who's wearing perfect footwear, who's not distracted at all, and they're not carrying anything heavy, or they don't have a child wandering around trying to keep track of. But actually, the more realistic approach, as we said, is to be mindful of the things that people bring with them in terms of risk. Distraction being a major one, obviously with our mobile phones most of the time now, but also these frail shoppers. Kind of the supermarket can be the last place that they really go on their own or in the public realm. So really thinking hard about how we can make sure we keep them safe.
Yeah, yeah. Fully support that, and it's a point that I make a lot too. I mean, if you think about the historic position which you've set out, and I've given some examples from a cost insurance claim cost perspective as well. We've got to remember that with demographics, the population is aging. You know, we're living longer, we're living more active lifestyles into an older age, which is obviously great, but that does bring with it some risk, as you've said. And that could be that people are working later in life. It could be that people are sort of more active in their leisure time later in life. But, you know, whilst we can sort of see extended active lifestyles, you know, you can't sort of fool father time, you know. So if, as you said earlier, if somebody who's a little bit older suffers a fall, they're much more likely to be hurt. It's going to have a much greater impact on their life. It's going to be much more, it's going to take much longer and be much more expensive for them to heal, if they heal at all. And so absolutely, we've got to be bearing in mind that, you know, this is only moving in one direction. If we don't change, if you know what I mean, if we carry on with the status quo, carry on doing just the basics and hoping for the best, this picture's only going to get worse. So, in terms of that's the general full fighter kit, but then you've also, and you worked in this sector as well. There's also a particular one for social housing, isn't there? Is that right?
That's right, yeah. So as part of the work that was sponsored by Barclay Group, I developed the kind of the strategy that I used at Trent and Dove, the home visits to vulnerable customers, and the training that I provided for kind of the frontline staff to help them spot fall risk and signpost vulnerable customers to me. All of that is wrapped up in a toolkit, which again is free and available on RoSPA's website. It is geared towards housing providers. There could be some lessons there for landlords as well. So people with you know a smaller stock who are still interested in providing the safest homes for their tenants. The idea, as I say, is to take those principles from the workplace and look at how we can palatably apply them to people's home, or just to give advice. From my experience, there was a great deal of value placed on having a professional come and have a look round, you know, come and tell me, you know, am I doing everything right? Are there any simple things that I can change, or what should I be looking out for in terms of my own strength and balance? How can I maintain it? And then how do I know when I'm becoming a little frail and when I should, you know, seek a bit of help from you know medical professionals?
Yeah, yeah. I mean, it's interesting, isn't it, with the social housing and housing association market, because, you know, just like in a hospital, you are sort of helping, assisting, dealing with perhaps a slightly more vulnerable than average population. And part of, I suppose, the challenge is, as you say, how do you cross that line between, you know, the communal areas where you've got a lot of control, and within people's homes where you might have some control in terms of how you can set them up to sort of to start with, but once that person's in there and they're sort of doing things to reconfigure or whatever, the control is much lower, isn't it?
Yeah, the conversations about safety can go in any direction, can't they? I guess a lot of people in the audience will have had a conversation that's gone really well, and then a conversation that hasn't gone so well. And it's really hard to predict. From my experience, it was always very important to set a level of trust from the beginning, to set an expectation that I couldn't wave a wand and make full risk go away. There was always going to be a risk, but there was certainly a lot of easy and you know and cheap ways that we could reduce it. But this was an accountability piece. It wasn't about the social housing provider, again, waving a wand and making it go away. There was a focus on creating outcomes from the visits that I did that were left with the tenant for them to act upon. And, you know, in the same way as you are, you know, a health setting, you're sometimes signposting people to support and saying, okay, you know, it's up to you now. The social housing providers can offer a great deal of information to people who may otherwise struggle to reach, have great links with professional health services. So there's lots of different ways they can support their tenants just by using existing services. And this applies to us professionals as well. There are plenty of existing services we can signpost. Diabetes UK, the local rep in Burton, was a fantastic support to me in my work up there.
Nice.
We know that, you know, people with diabetes often suffer foot pain, sudden foot pain or numbness, and clearly that is going to add to their risk of having a fall. So being able to signpost support in that way was very helpful and very worthwhile for both the housing provider and as well for the customer.
Yeah, that kind of approach of partnership, you know, I mean, that's I try and spend my life in a sort of business sense, trying to create partnerships. And, you know, this even today is an example, right? You know, we're trying to help spread the word about something that we're both passionate about by working together. And I think that is really, really important. And, you know, reach out to people on LinkedIn, go to your local IOSH group or your IRSM group or whatever it might be. You know, there'll be people there that have experiences and insights that can help you, whether that's, you know, within the health and safety community, other organizations that are like Diabetes UK, as you say, that are focusing out. Insurance company, you mentioned RSA, you know, speak to your insurance company, they might have some insight. So, you know, definitely think about what you can do to glean information from other people in this area and others, of course, as well.
Yeah, and I think because of the overlap with falls, particularly with people with age-related decline, there is a clinical element. So it would be foolish to try and solve it with, you know, a pure environmental approach. And it's useful to have a few things in the toolkit to say, you know, physical conditioning, yes. Mental health support could be useful. Certainly medication reviews and things like that. So signposting GPs is one thing. But if you have the broader your kind of repertoire of signposted support, the better. Because there are over 400 different kind of clinical risk factors that one individual can carry with them to make them more likely to have a fall. And we're not expected to know all of them. So I think it's about listening to the concerns that people have or the things that they carry with them, as I say, and, you know, learning all the time and not being afraid to approach the kind of the clinical teams as part of the NHS trusts. They're very useful.
Yeah. No, absolutely. So, as well as it being Sliptember, you wanted to highlight that the 15th to the 22nd of September is Falls Prevention Awareness Week. Could you just mention a bit about that? And is there anything that you're doing or RoSPA doing to support that?
That's right. It's an initiative that's been going a number of years, and just like your kind of Sliptember events, is designed to raise awareness of the kind of initiatives that are going on and tend to go on, you know, perpetually through the year, but gives people a chance to really focus on falls, you know, in fall. Of course, the Americanization of autumn is very apt, isn't it? And Sliptember works so well as well. But it's a chance just to focus and think, okay, I'm going to carve out a time, a week, a month to really focus in on this issue and try and make a difference. So having a key focus on your stats, your data, what your staff are telling you is a problem. And then think about, okay, well, but perhaps this is a great platform to run an initiative from and, you know, see if it hits the nail on the head. It is a good chance just to focus in on that single issue. So RoSPA will be promoting all of our kind of free resources through the week next week, just to try and give people an easy way to get involved. We know that everybody's very busy. Sometimes just signposting staff to fall fighter. They may help themselves, they may help their friends, relatives, loved ones. That's what it's there for. I think we mentioned earlier that everybody knows somebody who's affected, sadly, by a fall. You know, the stats tell a story, don't they? So really, signposting staff to fall fighter would be my recommendation. So let's get everybody through this training and well aware of the things they can do to stay safe at home.
Yeah, good stuff. We'll be doing some stuff on that next week as well to raise some awareness about Fall Prevention Week too. So from a sort of individual perspective, you've already highlighted going to the website and having a look at the PowerPoint and the toolkit and so on. So people that have joined us today can clearly do that. What about if somebody was working for an organization and they wanted to kind of get more formally involved at a larger scale? How does that work? Is there any kind of additional support or sort of programs or anything like that people should be aware of?
Yeah, I mean, RoSPA are always looking for partners. Our work as a charity is kind of mainly funded by our partnerships, and our partnerships are a huge part of what we do. So if anybody wants to get in touch, then please do, particularly if we're interested in developing different ways to help people change the perspective on slips, trips, and falls. That's how a lot of the fall fighter work started. That's how the work with Tesco has started. So really, if there's an aptitude for taking a focus on slips, trips, and falls, do get in touch through the partnerships email. So it's partnerships@rospa.com.
Fantastic. We'll move on and take a few questions in a moment, but just lastly, I guess from me, if we sort of cast our minds forward, say 3, 4, 5 years, what's your biggest ambition for the Full Fighter campaign, and kind of where do you think we could get to, realistically, over those next few years in terms of raising awareness and making a dent into this issue?
I think there's a great opportunity to use what is a key part of Fall Fighter, which is the kind of looking at health and lifestyle and developing an alternative pack for OSH professionals to help their employees understand how their health and lifestyle can increase their risk of slips, trips, and falls. I know that we would risk assess younger persons. We may need to start risk assessing older persons because of these risk factors that tend to come with age-related decline. So I think this is quite a controversial thing, perhaps to say, but I think it's time potentially to stop ignoring the kind of the medical conditions. I mean, mental health is already kind of going that direction, but start seeing the employee as more than just, okay, what footwear are you wearing?
Yeah.
And to start looking at that person with all the risks they carry. And of course, it's complex, and of course, it's going to be a challenge. But this is more real world, I think, than we have ever looked at. And certainly, there's an opportunity with the technology that's been developed to track and monitor all kinds of things about a person. It'll be a challenge as well to make sure that data is collected in an ethical way. But certainly, I think in the sense of protecting people and understanding those risks, better management of those risks, and at the end of the day, preventing accidental harm has got to be the focus.
Yeah, definitely. There was a case actually a few years ago. I think it was Morrison's. I don't know why it's all these supermarkets. It might be because of their size that they get sort of highlighted a bit more, or I won't say they get picked on by the regulator, but because that would be a bit controversial. But there was an employee who had, I think, epilepsy. You may have come across this one, and he ended up passing away. He fell down some stairs and passed away, and they were fined, I think, a couple of £1 million because they didn't do what you just said, which is take a person-centered approach and really figure out this person as an individual and mitigate the risks. I think it was around his locker was on the second floor, and why wasn't it on the first floor? It was things like that made a difference. So yeah, definitely with you on that one, looking at this much more holistically, much more in depth. Because I think, my sort of big hope would be that we just sort of try and move beyond just doing the basics, or just doing the status quo. We've got to do a little bit more, and it doesn't take, in my experience, multiples of times of investment, of whether that's time, effort, costs, whatever it is. It's relatively modest investments can have massively exponential results. Like your 69% reduction. I'm sure that didn't cost you 10 times as much as what you were doing before to deliver that, did it?
No, it's all the existing pathways and the kind of the existing partnerships that we have. It is just thinking, here's a problem, and what can I do? We already have a lot of what we need. Of course, there's a tendency to look at the exciting and shiny new things that are coming down the path, but oftentimes it is just doing the basics well,
Yeah.
that gets this big improvement, makes a big difference.
Yeah, yeah. I'd really encourage people, just on that point, actually, to um, have a look at this issue with a beginner's mind, because I think that, you know, everyone's doing some basic stuff. I'm sure you're the same, Jules. I've never met an organization that's doing nothing about preventing falls. So that's great because we're all doing something. But I think there is the possibility of sort of lapsing into, not reviewing it very often, and therefore you might feel as if you're doing the basics pretty well. Um, but I would sort of suggest that maybe the data would say we could be doing the basics a little bit better, shall we say? So I think if you could sort of take anything away from this in terms of a mindset, absolutely what Jules said at the start about taking this more seriously, but just yeah, be open-minded to a bit of self-criticism, or self-reflection, if you're leading safety in an organization, and just look at this issue again, and use the RoSPA toolkit, read my book. There are watch some videos, look at the full prevention week stuff. There's quite a lot of resources out there. Just have another look at it, and I'm sure you can find areas to improve. So a couple of questions from the audience. If anybody else has got any and they want to come and chat, then go to reactions, raise your hand, and come and ask. But there's a question here from Will. Do we feel a move towards more home working from 2020 onwards has or will reduce falls on the same level, or has it conversely made it more difficult to manage as people's workplaces, in inverted commas, are now bedrooms, spare rooms, garden offices, etc.?
I would suggest the latter. And I think we have made a rod for our own back by encouraging people to work remotely or from home. It's not a regulated space, or it's very grey in terms of how far we can tell people where you must do this and you must do that. For example, what do we do if someone has the staircase that you described earlier, Christian, the very Victorian, narrow,
Yeah.
steep, no handrails? I know that there was an attempt. I wonder if it was a successful attempt by, I think, a German employee, to implicate their employer in an accident they had on a staircase whilst working
It
from
was successful. Yeah, they were.
This
It
was
was ruled. Obviously, it's a different law, and stuff to the UK. But yeah, it was ruled that it was the company, who they did have to pay out that. Yeah.
So I think in terms of managing risk, we used to have one or two workplaces where all of our employees converged, and now we have as many workplaces as we have employees, and that is a challenge. I think that's something OSH professionals will have to look at as going forwards. We know that over half of the kind of hospitalising falls happen at home. It's really difficult to segment the data and say, okay, well, yes, it's working age population and they're having accidents at home because of the way it's recorded. But as I say, I do think there is a significant challenge associated with telling a person how they can organise their home to stay safe, and actually then getting them to do that. Giving the advice is one thing, as I alluded to earlier, but actually getting and making sure that an employee is organising their home workplace safely is difficult, and even more so if they are in a public space. Of course, if someone chooses then to go and work in a coffee shop or at the local park, that really muddies the water, quite literally, doesn't it?
Yeah, definitely does. And I would agree, by the way. I think the risk is greater. The other aspect to consider is with the sort of returning back to the office, because there is a bit of a trend on maybe coming back more, making sure that we're doing that refresher training. Because if people have been working mostly at home for a long time, they've kind of got used to doing things in their own way, in their own space. And then if they come back into the office and they are in that more regulated environment that you just said, we need to sort of remind them on what they need to do and how they should be behaving there from a safety perspective as well. There was a question here from me from Dom. What's the difference between a TRL slider 96 and a 55 when you're doing a pendulum slip test, and why would a tester use both? I'll take that one, Jules, in case you don't know the answer to that one.
Good, yes,
Um,
Chris, you take that.
so, so if you're measuring the slip resistance of a floor, the pendulum test is measuring the floor itself. What it's not telling you about is the footwear or the foot. And the reason that there are two different types of rubber slider used on the pendulum is that one is designed, the 96 is designed to mimic a standard shoe sole. Say that after a few pints of Stella. Um, and the other one, the 55, is designed to mimic a barefoot. So you would use the 96 in environments where you're expecting people to be wearing shoes, wearing footwear, and then you'd use the 55 in environments where you're expecting people to be barefooted. The other time to use the 55 is sometimes on very heavily profiled surfaces as well, because if you've got a hugely profiled surface, the hard rubber can sort of skid across the top and give you a slightly false low reading. But that's basically the difference. So if you're in somewhere like a an old people's home in their room, or if you're in a changing room of a leisure centre or a hotel bathroom, you would use both because you'd have shod and barefooted people. Whereas if you were in a shopping centre, then you shouldn't expect people to be wearing bare feet. So you'd just be using the shod one. So hopefully that makes sense. Yeah, no worries, Dom. Last question then, and then we'll wrap it up, which came in was any tips or resources or books or podcasts or anything around kind of the empathy and having those sort of challenging conversations with some of those older, relatives or residents or whoever it might be. Anything you've learnt in that space, Jules?
Mm. We have a video on the Fall Prevention Hub. People can go and watch. That's quite useful. I think nobody likes to be told what to do, and I think like we get this from our employees all the time, don't we? It's no different when you go into somebody's home. It's probably a little bit worse because nobody likes to be told what to do or how to live. Um, I think taking time to understand that person's needs first. So when I would go and visit social housing customers, we'd always talk about health and lifestyle before we looked around the rooms of the house.
Yeah.
You could plaster grab rails everywhere for someone who was perfectly capable of mobilizing without the need for support. At which point they might feel you're labeling them as someone who is vulnerable or needs all this stuff, but also you remove the challenge from their environment, and in doing so you rob them opportunities to develop and maintain their strength and balance. So making sure you understand the needs of the individual, and as you said, Christian, the person-centered approach has got to be the priority. Of course there'll be resistance. As I said, nobody likes to be told what to do, but by positioning the advice from a place of care and understanding, and having taken the time to listen, rather than just going heavy-handed, we're going to do this and this and you're going to be safer as a result, I think the advice lands better if you can do that.
Good stuff. Thank you so much, Jules, for the insights and sharing your experiences, and yeah, for all you do in this really important and sadly often underappreciated area. So keep up the good work, and do go and check out the Full Fighter resources, everybody, and get involved, because um, any single fall we can prevent is a worthwhile thing to do, because as we alluded to earlier, uh, you know there can be a huge impact from what might seem like something insignificant, but often it isn't. So appreciate everyone's time, and thank you for joining us, and we'll see you again on another Safety Roundtable in a couple of weeks.
Thanks for joining us on the Safety and Risk Success podcast. If you've enjoyed this episode, please hit follow and do share on social media. Does anyone you know spring to mind as a great guest, even yourself? If so, please contact us on podcast@slipsafety.co.uk. See you next week for another episode.